Hello and welcome to this Health Suppliers segment here on Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today. Our guest today is Dr. Steven Sandberg-Lewis. He's going to be a speaker at the 5th BioCeuticals Research Symposium. That's happening April the 21st through the 23rd in Sydney. He's a naturopathic physician, and he'll be presenting on his field of research into small intestine bacterial overgrowth. Welcome to Health Professional Radio, Dr. Sandberg-Lewis.
Thank you.
Now, your area of expertise is small intestine bacterial overgrowth, also known as SIBO or SIBO. What exactly is small intestine bacterial overgrowth?
The large intestine, or colon, normally has huge numbers of bacteria per gram, estimated at 100 billion or more per gram of stool. That large intestine is actually kind of short. It's only about 3.5 feet long. But the small intestine, which precedes it in the digestive tract, is 18 to 20 feet long, and it's normally a very low level culture area of bacteria, less than 1,000 or 10,000 gram. But under certain conditions that are pretty common these days, medications and other things, people can get overgrowth of their normal friendly flora in the small bowel, which can cause all the symptoms of irritable bowel syndrome, and it's associated with many other GI and systemic conditions. Probably one of the more common causes is infections in the gut, just parasite, food poisoning, traveler's diarrhea, whether it's E. coli or Campylobacter, any Giardia, any number of different organisms can start a process in which the immune system produces antibodies against a toxin produced by that organism, which is cytolethal distending toxin. And then that antibody will be, of course, present long after the bacteria are gone, and that antibody can slow down the migrating motor complex, the mechanism that normally moves things, sweeps things through the small intestine and prevents bacterial overgrowth. So overgrowth of normal friendly flora from that 1,000 to 10,000 to millions can occur, and that's where this often starts, but there are other mechanisms as well.
Now, at this 5th BioCeuticals Research Symposium, you're going to be speaking on not only SIBO, but other hidden gut disorders. When we're talking about hidden gut disorders, how do you test for something like SIBO?
The standard or gold standard for testing for bacterial overgrowth in the small bowel is duodenal or jejunal aspirate and culturing. With that method, you can actually find out what the organism is and the level of overgrowth. But that is not commonly used because it's invasive and expensive. And so more commonly, a breath test is done in which hydrogen or methane produced by these overgrown intestinal bacteria and archaea eventually ends up in the alveolar air and shows up in a breath sample. So you can measure their byproducts and get an idea of whether they're in normal numbers or overgrown.
So who is a candidate for small intestinal bacteria overgrowth? Is it something that is prevalent in older people, or is anyone susceptible?
Age is definitely a risk factor as people get older, but anyone who has had a traveler's diarrhea or food poisoning that led to the symptoms of irritable bowel syndrome after that, post-infectious IBS as it's called, they have at least a 50 to 70% chance of it being due to SIBO, and treatment for that can be very effective. Also, people that have had pelvic or abdominal surgeries that have led to adhesions, or a perforated appendix, or perforated peptic ulcer, anything like that that would lead to adhesions. And in fact, in women that have this twice as often as men, endometriosis is a major underlying cause.
So are there people who are more susceptible than others to this type of disorder? Is there anything that we can do to prevent it overall?
One of the best things you can do to prevent it is to not get food poisoning or traveler's diarrhea. So using herbal or prescription prophylactic treatment and being very careful about water supply and food when traveling, and just try not to ever get this in the first place, which can then prevent the whole antibody production. But also, some folks just can't get away from it. For instance, women have endometriosis and have monthly bleeding into the peritoneal sac. They're going to tend to have growing and expanding adhesions between the serosal layers of the bowel, which tend to cause kinks that slow down that cleansing process with the migrating motor complex, and they're just going to be very prone to it. And if they're treated, they're very prone to have it relapse. So those adhesions really need to be dealt with physical therapy and other techniques that can relieve them.
Is this the first time that you've been involved with the BioCeuticals Research Symposium?
Yes, I am lucky enough to have been chosen as one of the 5 presenters this year. I've never been to it before, and I've never been to Australia before, so I'm looking forward to the trip.
Great. Now, you've been practicing for many years as a naturopath, is that correct?
38 years, yes.
38 years. And in these, in your experience, have you found a much greater acceptance of your field of expertise as opposed to traditional standardized medicine? Or are things, is awareness becoming about the same as it ever was?
Big shifts in the United States where I practice. Back in the 1970s when I started practicing, we were pretty much fringe practitioners. We were licensed but didn't have a lot of privileges. And now, naturopathic medicine, while not mainstream, and I'm not sure if we ever want to be totally mainstream, we're definitely a major part of the primary healthcare system here, and we are designated as primary care practitioners in Oregon and Washington. Each state, of course, makes its own licensing laws, but yes, we're very much in the mainstream in terms of being part of the system and interacting with all the other parts of the system.
Right. Congratulations, Dr. Steven Sandberg-Lewis, and thank you so much for joining us here on Health Professional Radio today.
You're very welcome.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Steven Sandberg-Lewis. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download on SoundCloud.